Good evening. Thank you all for joining us. I'm going to go ahead and call to order our Fall Professional Health District Government Public Engagement Committee meeting for this Wednesday, October 27th, and it is presently 5:30 p.m. First, I'll ask for public comments. Do we have any public comments?
Oh, wait a minute.
Roll call. Sorry. Go ahead, roll call.
Director Schwartz?
Present.
Director Ortiz?
Present.
Okay, and staff, CEO Rachel Mason is present, and other staff, Judith Oswald, and me, Linda Bannerman, Executive Assistant. And you can introduce our guests.
Okay, this evening we are very pleased to have a presentation that is going to be provided by Herminia Ramirez, the COVID-19 outreach presentation. Ms. Ramirez is with the Migrant Health and Outreach Program and is the manager for that program for Vista Community Clinic. Welcome, Herminia. Thank you so much for joining us, and we so look forward to hearing all that you have to tell us about your program.
So Herminia, if you want to go ahead and share your screen, you can start the, oh, I'm sorry. Here, I'm jumping ahead now. We do want to go into public comment. We have someone else joining. So if there are any public comments, they can speak now. I received nothing via email. We don't have anyone else on the VAST conference call. It looks like Leticia is joining us. I'm watching her audio attempt to connect. And then we have two names on there. So you'll see Paulette and then Tamides. And these are both of our Spanish language translation interpreters. And then Daniela Vargas is our shared communications outreach personnel with North County Fire. Teresa and Judith are additional FRHD staff. All right, now it looks like Leticia is there. So Leticia, we just went into public comment. So if you had any statement, we'd love to see if you have any. If you don't, we'll go ahead and let Herminia start her presentation.
Yeah, I guess I have a public comment. Can you all hear me?
Yes.
Okay, so I was in on the, thank you for the opportunity. I'm sorry I'm late, I got dinner going, but thank you. So I was sitting in on the meeting or in on the meeting yesterday from the county Northeast efforts on COVID. And my concern is that although I didn't.
Leticia, we're not
a lot of partnerships and sport.
Leticia, I'm not getting any audible from you.
You can't hear me?
I didn't hear anything that you just said.
Can you hear me now?
I can now.
Okay, all right. So let me just start again. I was sitting on yesterday.
We're losing you again.
Addressing COVID for North County. I didn't get to hear. Okay, I'll type in my question on chat. Sorry about that.
Wonderful.
Thank you. Leticia. And then Tom, I saw that you've just joined us. Did you have a public comment while Leticia's getting her messaging done? And you're muted, so before you speak.
No, I don't have a public comment, but thank you for asking.
Okay, thanks, Tom. And I saw that Leticia is going to put something in the chat, so if you can all bear with us just a moment. Let's see what we can do here.
Go ahead and go on with the meeting because I need to open it up on the computer in order to type. I can't do it on the phone. So
okay,
I'm
Leticia, You're also welcome to circle back to me tomorrow, and we can make sure that your statement is either brought forward to board meeting, or we'll address it internally for you, okay?
Thank you.
Okay,
Great.
all right.
Thanks. Well, again, welcome Herminia Ramirez, the manager of the Migrant Health and Outreach Program at Vista Community Clinic. And we look forward to hearing your presentation on current efforts at COVID outreach in North County.
Thank you, Director Schwartz. I'm going to go ahead and share my screen. And thank you all for inviting me to share a little bit about the work that we've been doing at Vista Community Clinic. And so much of it, you know, I'm sure you all know we're based in Vista, but we do serve a large population of Fallbrook residents. And I'll go into a little bit more about that into the presentation. As was mentioned, my name is Herminia Ramirez, and I oversee our outreach and migrant health programs for Vista Community Clinic. And I'll be sharing today about our community-based COVID-19 efforts. So there was plenty more done in our clinics, but I will today be solely focusing on the things that we did via our programs, our community outreach and migrant health programs. So a little bit about the clinic, and these first slides are some just kind of general awareness of our organization. So I'll zip through them because I want to get to the good stuff of why we're all here today. But our mission and our vision is to really support community and in accessing premier health and providing the tools to the community where everyone chooses health. Here are our values for you all. And this presentation will be shared. I could share that with Rachel so that you all have this information at a later time. A little bit about VCC. We are a federally qualified health center, and we are also a migrant health center, which means we receive special designation and funding to be able to serve our migrant community. Additionally, we also seek to serve the community through a comprehensive community clinic model, which our goal is really to be a one-stop shop and be a health hub for the patients that we serve. Just to give you an idea of how many patients we serve over 76,000 patients in 3 counties. San Diego County is our biggest county, but we also have sites in Riverside County and Orange County. And we see over 213,000 patient visits. Through our health education and outreach efforts, we see 100,000 patients estimated out in the community. And again, just to give you an idea of who we serve 1 in 4 residents of Vista and 1 in 8 residents of Oceanside. Here's some of information regarding our clinic locations. Our Bell Terrace site is our home site. And relative to this group, it's also the site where we see the largest number of our Fallbrook residents, and along with our VCC North River Road site, which also sees a larger number of our Fallbrook patients. A few more of our sites. And aside from us being a clinic and offering primary care and medical services, we also have a large community health program, which means that we have a health promotion center dedicated to providing services in these programs. And we do have some that are missing, but we have these larger prongs. We have a large HIV department, a large youth development department that has after school programs and mentor programs. And you might have recently heard a KPBS article on our resilience program, which focused on serving folks who had been previously incarcerated. Our paternal and child health program, and our migrant health and community engagement efforts, which you'll hear most about today. So COVID-19. Where we started, of course, like many other organizations, we started looking at the data, and we rely on county sources for our data. So I'm showing two pictures here. So this is one of the county's most updated kind of dashboard, and I'm happy to share the link. I actually noted it below, but it didn't show up for you. Also, again, I'll share that information with Rachel so that she can get it out to you. But San Diego County, we're really fortunate that they put together a dashboard for us to be able to really extrapolate data and kind of look into more of what's happening with our community. One of the things that, of course, we want to highlight is for relative importance for VCC and the community that we serve. Vista, Oceanside, Fallbrook, of course, had higher numbers of COVID cases and confirmed cases. So this is where we really shifted kind of our strategies, and our biggest strategy was really responding to the numbers. The other picture, which you see there about low vaccination rates, this is an article that recently came out in the Union Tribune regarding the low vaccination rates. And there's definitely a lot of work that is being done. And it was an important article that, served to hopefully bring more attention to North County in terms of, why we have to approach North County differently, and, that we need more resources in North County.
And Herminia, I'm sorry, I'm going to stop you just for a moment. For those of you who aren't seeing the presentation, at the very top of your screen, there should be a small box that says View Options. You're going to need to switch that so that you're viewing Herminia's screen. If someone could try that, let me know. Otherwise, I have to go in and change a setting, and then Herminia, you'll have to try and reshare.
I did that and it worked.
Okay. So the rest of you, if you can all. Okay. So everybody should be good. All right. I'm sorry, Herminia, to interrupt you. Thanks, everyone.
Nope, that's okay. So really, kind of to sum it up, our strategy was just to look at the data and provide services where we had more capacity, which was kind of staying in our service sites, and all of them were Vista, Oceanside, and Fallbrook is where we dedicated the most resources. Here it is. Here is where one of the counties, the sites that I was referring to about where all the kind of information is housed, and you can look up things by date of illness onset, by map, by zip code, by ethnicity. And here's a link for you all of where you can access that information. So really our biggest challenges in North County were, of course, there was a lot, and this is by no means a comprehensive list. This is just kind of the biggest brunt of our kind of efforts that we tackled during COVID. The big one being misinformation. There is as much misinformation out there, if not more, about vaccines and about COVID than we'd like to, and that our team can even keep up in terms of combating that. The other challenge was nuanced and fast-paced changing information. And what I mean by that is you practically have a scientific degree of some sort to really understand the science behind the vaccines, and so how do you really break that down and make it accessible to communities? And kind of along with that is the fast-paced nature, right? For a few weeks, I think I felt like there was something new changing every week. And so how do we, as trusted messengers through our community outreach program, really keep up with that and make sure that the community has the most up-to-date information? And then with nuanced is now one thing that we're seeing is the individual hesitancy. Obviously we're all combating hesitancy and we want our community to be vaccinated, but at this point, cases are so individual. And I'll give you an example. One of our very own staff members, he has a heart condition, and his two physicians can't agree on whether he should get the COVID vaccine or not. So a lot of what we're needing to do is that case-to-case information, kind of very individualized. And when you're so spread out, which is kind of the next point, North County has a very unique landscape, and we're often being compared to San Diego. And though we still are a part of San Diego, I think people forget how geographically different we are from from central San Diego, and how we don't have those hubs of concentrations of larger populations. Our population is more spread out, which means resources have to be allocated differently. And so that's kind of paints the landscape in terms of what we were responding to and what our challenges were ahead as an organization. So our strategies our biggest strategies were really to use our líderes comunitarios, and which it translates into community leaders. And they're really trusted messengers. It's hearing that the vaccines are safe and effective from your very own neighbors. And VCC counts with the support of a group called Poder Popular, which is VCC's volunteer legacy group. And they've been active for over 2 decades. And some of these pictures that you see here are actually in Fallbrook, them doing focus groups in Fallbrook, doing skin cancer preventions with one of our volunteer physicians in Fallbrook. And, there's cultural components in terms of how we deliver the messages, but we really try to use a peer-to-peer model. So our efforts would not go very far if we didn't have the support of our Poder Popular líderes. And so this is a big kind of shout out to them, and also one of our most trusted best practices that we resorted to during COVID outreach. So for VCC, we have 2 buckets of how we're doing this work. Our general outreach team has a just general focus. We're trying to canvas all of our service areas, which I mentioned at the beginning. And we're doing that through what's called Project SAVE, which is highlighted here. Project SAVE is a county funded effort that relies on making sure that we're saturating our communities with health education, but we're bringing additional resources to it. We have our mobile unit, which goes out into the field and provides vaccination and access to testing. We work through our partners to make sure that we're taking and deploying testing and vaccines out in the field. And we're also doing food and diaper distributions during this time. We know COVID impacted communities in more ways than just an illness, but also led to job loss, wages lost, and financial hardships. And when we're trying to connect with the community about getting a vaccine, if they're worried about where they're getting evicted or where they're going to get food on their table, the vaccine is not going to be top of mind to them. And so our strategy was really to address these other issues that would also support these and get people connected to health resources. We have a Bridges to Health program, which is currently just based out of Vista and Oceanside, but basically we take our certified enrollment counselors and we host office hours at community centers. A lot of times people get letters in the mail from Medi-Cal and they just want someone to read the letter to them because the letter didn't come in an accessible language. And so that's really kind of the goal of our program, is to have community presence and have these resources that would normally be housed in clinic out in the community. And of course, we used our text messaging and social media channels to provide information about testing sites and information about vaccines and where we're hosting this event. Our other bucket is our migrant health bucket, and it's very similar. The only difference is that it has a population focus, which is our farm worker and migrant communities. And these efforts are under a project we call Project SAFE. So we get them confused all the time. And Project SAFE is, again, farm worker focused. It's funded by UC Davis, and it really provides and seeks to saturate our farm worker and migrant communities with health education. We've also done a lot of COVID and PPE distribution. We also support with appointment assistance and our finance assistance program, which we'll hear about later in this presentation. And then of course we used our text messaging efforts. And really for VCC, our goal was just to stay out in the community. As organizations, we build trust by what we're able to deliver. And so we wanted to make sure that we stayed out in the community and brought resources to the community. So here we're at a local nursery in Oceanside, and we're doing a vaccine event with their staff. So our food and diaper distribution efforts I also want to highlight, because these became critical points of connection with the community. And just to give you an idea, before COVID, we used to only do food distributions 1 to 3 days a month. And because of COVID, we have switched over to a 4 to 5 days a week model. So we're out in the field quite a bit. And we do it so that we can stagger people, so that, you know, we would see, you know, pretty big numbers of folks, and we wanted to provide safe environments. So we shifted to an appointment-based system and also drive-through. And we are serving between 600 and 700 people. It just all depends on the amount of food that we get that month. We get our food from Feeding San Diego and the San Diego Food Bank. And we support families and individuals in Vista, Oceanside, and Fallbrook. And just to mention, in Fallbrook, we set up our own kind of impromptu distributions, working with one of our líderes. Her name is Marisela Monroy. She lives in Fallbrook, and she organizes a lot of the farm workers there. And Marisela will let her know we're coming this day, and she informs the whole community, and then they meet us to receive the food wherever we're going to be, or we take it to wherever is closest to them, wherever they tell us. And that's the same for our diaper distribution. We serve close to 300 individuals per month. And people can, VCC is a diaper distribution site. So even when they've already gotten access to them, if they're in need of diapers, they can always reach out to any of our program staff, and we can get them connected to resources. Our Bridges to Health program, this is just the big highlight here, was certified enrollment assistance to Covered California and Medi-Cal, and doing that out in the field, because a lot of folks, again, got letters in the mail, had questions about pandemic EBT, all of these things. And our goal was really to keep resources out in the community. And maybe one day we'll bring this to Fallbrook, but as of now, we're in Vista and Oceanside with this program. So a little bit about our county contracts to do COVID outreach and education. Through the month of June 2020, which it has ended, we were contracted as an agency to provide testing in the community. And we did this through our mobile unit. This contract has since ended, and VCC has rolled out a little bit of a different way to do community testing, and we're still doing testing out in the community. We're partnering, and we're basically responding to partner requests on a month-to-month. So we're working with the city of Vista, MAC, Migrant Education, and wherever partners request us to go. Of course, there are some parameters in terms of requesting us to go. We want there to make sure that there's that demand, because pulling resources out of a clinic right now is a pretty tough thing to do. And our Project Save program, which you heard about, and this is an ongoing contract through the month of January, and it focuses on doing peer-to-peer education. So some of the things that we're doing right now, and you see some of our líderes there, our community leaders and our staff, our VCC staff, they're out in the field providing health education. We're also doing door-to-door canvassing, and we're launching that sporadically depending on where we're going to offer testing and vaccines that week. One of the benefits that came out of Project Save is that we know we're a large organization, and we know that people want a direct phone number where they can get resources to, and that's really one of the things we were able to create. So this number that you see here, 760-631-5000, extension 1011, is an extension that will connect you to a lot of folks in our team regarding any COVID health education, COVID assistance. We don't only help schedule in our clinics, we also help connect people to county sites, and we also help them to get transportation to these resources. And so that's a key resource there. And our biggest resource right now is our medical mobile unit. And this was launched in October of 2020, and it has been focused, even though it's a general medical mobile, and that's its goal, to one day be providing healthcare out in the field, primary health. Right now, it's known as informally known as our COVID mobile. It wasn't supposed to be, but that's, you know, kind of what we're having to do now. And our mobile unit goes out into the field and provides testing, vaccines, screenings, all kinds of services, and connects people and delivers these services. Here we're at a work site at a nursery, and really it's bringing health and health resources to the community. Some of the things that we were able to do, and this was, the food distribution is an ongoing project, and our partnership with Universidad Popular en Voces was earlier on the pandemic, and we haven't partnered with them since, but we hope to. And we had some Fallbrook specific efforts. So UCSD Border Health was a project that we brought to Fallbrook almost every year, but with the pandemic, we had to regroup, and we were no longer able to offer screenings or physicals out in the field. And so what we ended up doing was turning it into a donation drive. And this is, the donation items are collected by UCSD, and then we go out into the field and distributed them out. One of the things that we're collecting right now is, and this is a request from Fallbrook, from farm workers communities in Fallbrook, is actually tarps, because the cold season is coming or is here. You know, they use it to, a lot of folks live in, you know, their housing is subpar, so they use it for roofing and kind of heat. And so right now, that's one of our focuses, is collecting tarps that we will then distribute out in the farm worker communities in Fallbrook. And when we talk about Fallbrook, we're talking about the Luz area. So, you know, way in Fallbrook, where we lose even cell phone service to go, but I'm sure you all know that better than we do. And again, this is in partnership with our leader, Marisela Monroy, who is helping us make sure that the community hears about our resources, and she collects the information about what's needed, jackets, flashlights, what's needed during that time. And our partnership with Universidad Popular en Voces, early on, Voces and Universidad Popular really rallied around the Fallbrook community, and they deployed tons of vaccine events. Well, VCC, we didn't have the capacity to provide vaccines in such large quantities, but what we could do was do outreach and provide language access and support on education to folks receiving the vaccines. And so we were there providing PPE distributions, and we found ways to kind of leverage that partnership and still support, even though we weren't the vaccine suppliers for those events. Our focus in migrant health is really working with our agricultural partners to make sure that workers are vaccinated. And so that really came and was supported by our Project Safe efforts. And these efforts will be ongoing until 2022. And again, they provide just that targeted outreach. We do things called pláticas, which we go on their workers' breaks and just provide these short talks on why they should keep getting tested, even though they've already been vaccinated, why vaccines are important, and just really reiterating or repeating those messages that are so crucial. So here's some pictures of us at local agricultural sites. And here are some of our sites that we partnered with. And so we were really all over North County, Oceanside, Escondido, Fallbrook. We also partnered with some manufacturing and factory work sites. And then here are some of our community partners. MAC is highlighted because we have partnered with MAC at Fallbrook sites. MAC has been allowing us access to our mobile unit to bring it to Fallbrook sites. And it was cut off, but Migrant Education also provided access to sites in Fallbrook. And one thing I wanted to highlight for this group is we actually were able to partner with the Fallbrook Regional Health District on one of the migrant education events. And migrant education families were referred to these vaccine events, and then the Fallbrook Health District helped host the event, which, you know, facilitated a location, and you know, families were connected to these other resources. So for our farm worker community, I've already gone through some of these efforts, but aside from vaccine, COVID health education, we've also done other efforts that I want to share. And you already heard about Project Safe. You already heard about our food drop-offs and our supply drives and our partnership efforts. And what I'll highlight next is our cough survey efforts and our finance assistance program, which helped and were also rolled out during the pandemic. And first, I want to take a pause and just share with you all who and what agencies make up Farm Worker Care Coalition. But VCC is the fiscal agent and backbone organization for Farm Worker Care Coalition. Also has been around for almost 2 decades now. And the mission of Farm Worker Care is to recognize farm workers as vibrant components of our community. As of now, we're a 40+ member agency. We have representation from the Fallbrook Regional Health District. Kate and Rachel have joined in the past. And we also have county partners. We have education partners, insurers. So we really have a very diverse kind of range of who comprises our Farm Worker Care Coalition. And we also hear from our community leaders. This meeting is open to them. And we always strive to make sure that we are an inclusive space that way. And so Farm Worker Care Coalition, VCC takes on the brunt to apply for grants and make sure that there's sustainability that way. And through those efforts, one of the things that we were able to do with the pandemic is the Farm Worker Care Finance Assistance Program. This is a program that was rolled out twice. Once June 2020 through October 2020, and then most recently March 2021 through June 2021. And Farm Worker Care Coalition was awarded $450,000 through Grantees Concerned for Immigrants and Refugees. And these funds had no tiebacks or financial kind of gains for VCC. These funds were just funneled through our agency. And we created the Finance Assistance Program, which gave folks a $500 check to anybody who was eligible. Our focus, of course, was farm workers, but we, at the end of the project, received some more unrestricted funds and were able to open it up to essential workers. And I should note the program is still open today because of those additional donations we received. And one of the things, as we collected minimal information, and that's just we collected the information we needed to issue out a check because this program was meant to be deployed with and no questions asked to participants, right? And it was all self-attestation. And one of the things that we learned is that people's #1 concern was rent and housing. And that was, you know, what people were most concerned with during the pandemic. To date, Farm Worker Care Coalition / Vista Community Clinic have dispersed almost $500,000. We're not quite there yet. I think we're about $5,000 short, but we should be in that mark within this month. And so we're still, you know, wanting to respond and be flexible. We know that people use these funds for housing, for food, for their bills, and that was really kind of a proud point for the service we provided out in the community. The other effort that we participated in, and this was earlier in the pandemic, this was a survey that we partnered on with the California Institute for Rural Studies. This was called the cough surveys, how it's known. And this survey really sought to collect how farm worker communities are being impacted during COVID. There's been many phases, and one of the big successes is that this information was collected at the beginning of the pandemic, and it has since gone through some iterations. Farm Worker Care Coalition was one partner, and most of our data of the farm workers we interviewed for these efforts were Fallbrook residents. So really good information about how folks were impacted during the pandemic, and the website is here where you can find reports and updates about these efforts. So I'm getting to my to the end here, but just to share with you a little bit about what our impact looks like. We come into contact with 1,500 individuals per month, and that's through our food distributions, through our outreach efforts, through attending community events, through our social media contacts. To date, we've distributed over 30,000 PPE kits. I hope you all have seen some VCC masks out when you're out in the community, and hopefully that's because we've done a good job in getting things like masks, hand sanitizers out in the field. Our team has scheduled over 1,500 testing appointments, and our outreach team, so this isn't what the clinic has done, this is what our outreach team has done, has scheduled 500 COVID vaccine appointments. And we just launched our canvassing efforts in September, but we've already reached 6,000 households through our canvassing efforts. And I apologize if you hear dog barking. That's my dog wanting to speak his mind here around what I'm saying. So for our mobile unit efforts, we have done 190 COVID testing and COVID vaccine events in the North County. 18 of them have been agricultural sites. 2 of them have been workplace specific sites. 9 of them were migrant education sites, and 2 were community locations. The other ones that are not kind of grouped under here have just been general events that VCC has led, and we've been hosted them out of parks and other places that we get access to. And we to date have provided vaccines to both doses to farm workers, to 328 farm workers in North County. In total, the number of COVID tests we provided was 3,700. And of course, this number is growing. And it got cut off for me there when I translated into Google Slides. But one of the things that we are watching for is those spikes. And in January, we had the highest number of COVID positive cases. We had 31% of positive cases of anyone that got tested with our mobile unit. And we're sort of, as an agency, watching what that will mean for these upcoming fall months, with the colder weather, with all of the holidays and more chances to people gather. And so we're gonna kind of keep watching those numbers. And just lastly, some of the highlights and kind of where we've structured and where we wanted to maintain our work is just always staying community centered and responsive. So things like that cough survey, things like the finance assistance program and collecting information have really allowed us to collect information as we go and respond to that. Where we take our COVID mobile unit, where we distribute food, all of that, we've tried to do as much as we can to be responsive. Using the trusted messenger model, out in the field, we know vaccines and putting something in your body is a personal choice, and folks need to trust who they're getting those messages from. And we certainly want to make sure that they're getting these messages from people they trust. Providing a comprehensive look, really understanding that the pandemic, and we're a clinic, so of course we testing and vaccination is important, but really responding to COVID in a comprehensive way through partnerships, and of course what I mentioned at the beginning is following the data, allocating resources to where we're seeing the higher numbers, where we're seeing folks need the most access, and seeing where we can go from there. And that is it for my presentation. I don't know if anybody has any questions for me.
Thank you so much, Herminia, and Rachel can go ahead and direct the questions.
Sure, and actually, Herminia, if you want to go ahead and close your slide, we'll go back to just a basic screen share again. Perfect. So hopefully at this point, everybody is back to seeing each other's faces. Yes?
And we also see the agenda, Rachel.
Okay, so depending if you have two screens, sometimes that's trying to move things out of the way so you're not looking at all the crazy stuff I'm looking at. But do we have any questions from our audience members?
I would certainly like to ask a question, Herminia. I'll get things started. I noted the 328 farm workers you had indicated had been vaccinated. Has your program been able to collect any data and conversations with community members about vaccine hesitancy and about their concerns in getting vaccinated?
Sure. Yeah, we certainly have a lot of anecdotal information in terms of why folks aren't getting vaccinated. A lot of folks sort of are waiting to hear from their trusted messengers, right? And so I'll give an example. My parents were hesitant at the beginning, and they didn't get the vaccine until my sister and I got the vaccine, and then they saw it was safe. And so for them, they needed that trust factor. It's very, like I said, at this point, individualized. And one thing that's a bummer is in our canvassing efforts, we actually have gotten yelled at. We're getting to the most hesitant, right? Anyone who's, we're getting to the most hesitant group. And so that sort of has been a challenge. A lot of folks, I think historically looking back, there's a lot of mistrust in the government, and that isn't something that we're going to change very easily. So those are some things that we're hearing. The other thing is, there's a lot of fear, and when people are unsure, we know that if they're uncertain about doing something, they're not going to do it. And so that's really kind of been our goal of hopefully catching those folks that are on the fence and kind of tipping them over to getting their vaccine.
Thank you. And the 6,000 households that you reached with canvassing, what type of information did you provide in the canvassing?
Yeah, so our role at VCC has really been to be the health expert. We take the information that the county puts out and we put it into flyers, social media posts. We sort of chop it up because it is a lot of information to have at one time. So we highlight to kind of focus it more. And we're actually really lucky to work with UC Davis because they actually have a whole team that's creating more specialized and kind of focused health education. And so we have kind of like a 5-tip sheet. And we have tons of other health education information that is organized by population. So we have things about teens, we have things about children. We're working on things about children. We don't have that yet, but that's one thing we're working on next.
You're muted, Kate.
I muted myself because of the feedback, but thank you so much, Herminia, again, for that information and for the wonderful presentation. Can you tell us a little bit about your partnership with Universidad Popular and how that's working out?
Yeah, of course. Universidad Popular is actually a long-term partner. They actually were one of the partners that was in the founding of Farm Worker Care Coalition, in the founding of the Poder Popular group. And so we've been partners for a long, long time. And in these specific efforts, Universidad Popular and Voces really rallied around bringing vaccine resources to Fallbrook. And because of the higher numbers, I mean, some events that were organized were done through Voces that were done through the county, and they were vaccinating 300 people, and we were there as outreach and education.
Great, wonderful efforts. Thank you so much again.
Do we have anyone else from the audience who has a specific question or comment or concern on the presentation?
I just wanted to, hi, Herminia. To say hello and also just say that it's really wonderful to see the like holistic approach, kind of like you're saying, definitely making sure that you keep a pulse on community needs, and specifically with like financial support. We know folks are really going through it and experiencing hardships, so having that kind of an approach, I think, is just proving to be really like mindful and sensitive, and that's kind of what it feels like community definitely needs. So you know, just hats off to the outreach team and everybody doing that kind of legwork, and folks at VCC.
Thank you, Stephanie.
If we don't have any other comments, I'll just quickly note that.
I have a quick comment.
Oh, sure.
Let's see, how can I do this? I'm getting feedback.
Okay, Leticia, both of your, you're on here twice, so I'm not sure if you want to try which one, sorry.
So can you hear me?
Yes, we can.
Okay. So I'm on the computer to type and on the phone to listen. Okay, so first of all, I just want to say thank you so much for that presentation. There was a lot of information there, and I would like to find out if there's a way for us to access, you know, some of these websites and so forth that you put in the presentation later on. And Rachel, you're the one that can probably answer that for me.
Yeah, we'll have this slide deck put onto the website, as well as the Zoom recording. We've figured out our own technical logistical challenges, so we should be able to get this presentation up onto the website by the end of the week. Okay. And so obviously the slide deck will be listed there as well, so that you can scroll through and grab any of that data that Herminia discussed this evening.
Okay. And then the other thing is, I served on the board of the Vista Community Clinic years ago, and it's very encouraging to just know that the commitment to farm workers, the commitment to low-income families is so strong and is growing. And any way that that we can partner with them as a district, I think would be such a benefit for Fallbrook. And I know that relationship exists. So I'm just, as a community member, just hoping that we can keep accessing that resource for the benefit of the community. And anything that we can do in terms of outreach to get into the neighborhoods and just keep encouraging people to be open-minded and to get vaccinated is going to be a great help for us. So thank you very much.
And I'll note on to that, Leticia, actually, Kate and I just had a conversation yesterday, specifically about how we can better partner with our federally qualified health centers, our other community partners. Obviously, the health district has had a bit of a reorganization in the last year. There are some additional notes that I've taken here. So Teresa, who is on our site here, is our wellness center administrator. So I think we have the opportunity to expand some of those relationships now that the wellness center is really much more open and available for community groups. I think this could be a good site for us to have some more ongoing support. Obviously, we know VCC and the Fallbrook Family Health Center and neighborhood healthcare, everybody has kind of their carve-outs, but it would be nice to be able to support the Farm Worker Care Coalition a little bit more. Now that we have Danny, who is our shared staff with North County Fire as well. So we'll look at coordinating some schedules to see if we can have better representation at the coalition, as well as a few other partnerships. So that is definitely part of our much larger goal and that we haven't been able to move on it as quickly has definitely been a challenge for us. But we aren't going to stop. We're sorry we're not going as fast, but we've got some internal processes that should allow us to go a little bit quicker now.
Very good. Thank you.
And thank you, Rachel. Herminia, I wanted to add that if there's some educational outreach efforts that you want to make sure that Rachel is aware of, so that we can also get that on our website. And also any ways for us to improve our outreach, say with this video of your presentation, and how to get that to the right places out in the community. Any suggestions you have, we'd be very open to and would love to hear them.
Yeah, well, I think we definitely do have some pending conversations and kind of ideas that I think we can all work together on. And we are working actually to reach out to some apartment complexes in Fallbrook. And the MOU processes aren't as the easiest. So maybe we can all kind of brainstorm a workaround that and bringing access to that. But I think as an agency, we're adding right now, we're adding another team member. And so we're looking to get more capacity to be able to really canvas those areas. And I think really engaging with community members who might also want to support this and have efforts similar to Poder Popular, and really, host canvassing events, for example, which I know have happened, and maybe we can co-organize some of those things and kind of lead those really grassroots efforts. Because I want, Leticia has been such a wonderful advocate, and I was actually at the same meeting where she attended, and nobody, the community doesn't look at those websites. It's our job to get this information to them. So, I just want to make sure that Leticia knows there are folks that are listening, and I'm sure we have, we're all working on strategies in terms of how can we make these videos, make the information really more accessible to the community.
Thank you.
Great, thank you so much. And also, Rachel, I was just thinking about on our social media posts and outreach, perhaps it would be a good idea to post several times weekly some of the disinformation from the CDPH website with questions and responses, and to highlight some of that information in our social media and to local Fallbrook social media sites.
Sure, and I'll circle back with Danny and Teresa. We have some upcoming time together, so we'll kind of put forward a schedule on that. That is something that's under development right now, but we'll make sure that that messaging is prioritized.
Thank you. One last question from myself for Herminia is there any specialized outreach to the Spanish-speaking senior population going on, or how do you connect with that part of our community?
Yeah, we certainly had a whole campaign, and we still, I mean, once we start a campaign, we kind of keep it and have it as an added tool in our toolbox. But we had a campaign that we partnered on. It was on specifically targeting the Latino elders, but through a culturally kind of sensitive way, because we know that Latinos are less likely to be at retirement homes and still living with their families. And so our kind of broad outreach really sought to respond to that, and really prompting the entire family that was eligible to get vaccinated to also vaccinate themselves and the seniors. We often saw kind of the reverse. Seniors were getting vaccinated, but the rest of the family wasn't. And so that often doesn't, those are some of the dynamics that we were seeing. And so there was a whole kind of, the endowment and a lot of other places really kind of responded to that and had some messaging around protecting yourself is protecting your family. And so our ways to really connect with Latino elders was to just canvas. And I think that's our way really to respond to everyone, just because we know there's a lot more interconnectedness. One thing that we see a lot more in both low income and Latino communities is multi-generations living together. And so really working to that door-to-door canvassing where we can kind of go to them and work on that.
And Danny, you indicated you'd like to make a statement about the social media if you want to chime in real quick before we move away from any of that topic.
Yes, I'm so sorry. So I did put together a social media presentation in terms of our analytics. I think in terms of posting, I do understand that we need to get a lot of information out there, but we want to be very careful about oversaturation of our social media posts. I would definitely encourage us using different tools, features that we have on both Instagram and Facebook that would, and particularly Kate, what you're addressing, I would probably put on stories. And that's something that's only going to stay up about 24 hours. That way it is not within like our permanent profile and it won't feel overwhelming for folks. So I can address a little bit more in depth about what my reasoning is behind that. If we are going to be going into a little bit of the report that I gave today.
You know what, and Danny, we'll probably bring that forward at another meeting specifically, but I think that that's a good thing to help educate all the staff as well as the board, and then bring that forward at the next government public engagement for sure.
Thank you.
Okay, thanks, Danny. All right. Any other questions, or else Kate?
And I want to thank Herminia so much for being with us this evening, and we do look forward to many, many future conversations and partnering together to really work for our communities. Thank you for all you do, and of course, as an ex-BCC staff member, I so appreciate BCC. Thank you.
Thank you.
Yes. So Rachel, are we moving on then on the agenda to 4A?
Yes, we can.
Okay, thanks. First question that I wanted to ask under our information-only government was, how did our first testing vaccine clinic go with offering booster shots?
So we had our first event last Monday. They had offered actually Pfizer at the previous event. We did have some, and I know, Teresa, you texted me from the event the total number. So whichever one of us is faster on that can report on that. We are seeing a lot more inquiries via the phone. The nice part about the booster availability is the fact that all of the commercial pharmacies, the Fallbrook Family Health Center, as well as our own CAL FIRE sponsored events, all are now making boosters available. The CAL FIRE partnership only can bring Pfizer at this point. They are looking to bring a few others, but we're getting a good increase in call volume again about how to do that. This time we're letting folks get a lot more information about how they can access it through the different pharmacies. The other questions have been so far about accessing Moderna and Johnson & Johnson. Obviously, that is the breaking news. Moderna's boosters will be more readily available in a short term. We're still waiting to see exactly what will happen with Johnson & Johnson, but Pfizer boosters are readily available and they've already been being put forward. We had, Teresa, do you have the number? I'm sorry, I couldn't find it.
Yes, I did just find it. We had 51 COVID vaccines given, and I don't have the breakdown between boosters and first or second doses. We had 12 flu vaccines and 60 COVID tests.
Thanks. And we should be able to get that number from not only the CAL FIRE, but also from Fallbrook Family Health Center. Typically, I get information from them at the end of each month. Usually I'll have something additional from Champions for Health. They were at several events under our partnership as well in this last month. So there's actually going to be a great bit of detail that will come out, but I'll usually get that at the end of the month. So I should have that for November's meetings.
Wonderful. Thank you so much. And of course, the major news coming out effective this week is about the U.S. moving a step closer to expanding the COVID vaccines for children and the steps that the federal government's going through in that process. The FDA advisory panel voted unanimously with one abstention that the vaccine's benefits in preventing COVID in that age group outweigh any potential risks. And we'll be talking more about that, of course, in the November upcoming board meeting, and I'll give a brief announcement about it at that time once we have more information. I imagine probably effective next week, we'll also begin getting some questions to that effect, Rachel, and I know that we had also been partnering with some of the school districts already in terms of vaccine clinics for the 12 and over age groups, correct?
Correct. So again, we're really waiting to see what the direction from the county will be about how they'll want to handle youth. When the Pfizer availability for 12 and older first came out, obviously parents had to come with their children to these events. We will be as available as we can. Again, the readily accessible vaccines through commercial pharmacies is likely where you're going to see more of the shift. Our county partners are moving away from many, many days. The CAL FIRE teams are going back into the district or into the world of fire suppression. So we will see fewer clinics through our sites, and that gives us less access to being able to do those. So we are still working as an information hub and helping people get signed up through the Walgreens, CVS, Rite Aid, directing them specifically to the Fallbrook Family Health Center in town for those who are more technically challenged and want to go person to person. So we're working on those avenues, and I have no doubt that we'll have to follow that same process for when the children's vaccines do get approved and become more available.
Can I make just a quick question or a quick comment here, Rachel?
Sure.
So in relationship to the other sites, the Albertsons and so forth. So I went to, because they're supposed to be just walk-in friendly, right? So I took my husband to all of the local pharmacies, Rite Aid, CVS, Albertsons, as a walk-in, and none of them would take us.
No.
So it's not a big deal. You know, I shouldn't say it's not a big deal, but, you know, so I had to come home and make an appointment for the following week.
Yes.
So I am relatively capable of doing that. But if we're encouraging people to go to those places, it needs to be a more accessible way for them to get in there.
Well, we completely understand. Trust me, we've been trying to get our local pharmacies to be a little easier, but every single one of them have very clearly on their website that you must have an appointment. So as people are challenged with trying to get through that process, we're helping walk through and make their appointment with them. So, I mean, I can tell you, well, I can't tell you. I just know that Tracy has made a number of appointments for local individuals where she is making that appointment online through this with us. We unfortunately don't have any kind of power over those, you know, corporate level pharmacy decisions. So we're continuing to try and leverage what we can through Fallbrook Family Health Center, and they have been able to continue their testing and vaccination openings. We're still working on trying to see what else we can get with Champions for Health for more of those pop-up clinics in the very difficult community areas. So a lot of the senior housing and a few other places. We've been able to get them to do some things with Bonsall School District and a few others. So that will likely be our resource for those areas that are less likely to have the resources to make those appointments through commercial pharmacies.
Okay, thank you. I just wanted to make that point. Thank you.
Yeah, we know that they're difficult, and we would love to be able to say, just like, you can't even call the local pharmacy at CVS, Rite Aid, whatever, and walk in. All of them push you through their online appointment process. And there's no way around it. So our best workaround has been, we'll try to help those folks make that appointment through us just basically talking to them and filling out the form online with them. Just like we did in the early days when everybody was scrambling through My Turn or the health book scheduler, all of those. So we're still doing that piece. It's not ideal, but we're still trying to get folks that way.
Thank you, Rachel. I wanted to echo both of you, Rachel and Leticia. I had a similar experience going into CVS and being informed that I had to go online in order to make an appointment. And they wouldn't even provide a phone number, to call to do the same. You had to go online and do it through the internet. So that accessibility is not always really helpful. And I'm glad to hear that Tracy at our health district is helping individuals with making appointments, assisting them with that. And I imagine the Foundation for Senior Care is also continuing to do the same for seniors. Is that correct?
Yep.
Okay. Good.
Yeah, their care advocates are still working that way as well. And I know that they've had Spanish-speaking care advocates so that they're not having to just shuffle everyone over to Culver County Health.
Good. And I did note an information today on the California Department of Public Health website. They are noting that now for those of us who can get a booster of Pfizer, Moderna, or J&J, to go to My Turn if a booster is recommended for you. And also they're recommending that we all speak to our physicians, our personal physicians, if we have one, regarding getting an additional dose and whether that's right for us so that we can make the best decision for ourselves. Okay. Rachel, do you want to speak to any upcoming vaccine clinics that we have coming up that we'll be hosting? I know that we just did on the 25th.
Yeah, we just did the last one. The next one, I believe, is of course, I should have known, is November the 8th, 15th. I think I have it memorized. We will have it on our website, and then we'll promote it. We don't typically promote it until we know that they have opened the My Turn appointment system. We've gotten feedback that it just annoys people that we promote something and then they can't immediately go onto the site to make a reservation. So we'll have that available approximately 3 to 4 days before the event date. Keep in mind, you can pretty much always go to the county site to find where specific testing events are going on and or vaccination events. We've been promoting those 2 links specifically, and the specific link, not just the county site, so that folks can hopefully find a site that will meet their need.
Great, thank you. And also, I like to always remind everyone, if you do not have a digital copy of your vaccine record, to go to myrecord.cdph, which is in California Department of Public Health.ca.gov, okay, where you can get your digital copy, which of course will be helpful when you go to get your booster. Okay. And do we have any additional information on upcoming public engagement?
Nothing specific. So Teresa and Annie have put forward their first report. We'll bring that it'll be in the board packet, and then we'll bring forward for the next meeting when we don't have a presentation, a little bit more detail, as well as a little bit more information about our upcoming outreach plans. But right now, the main thing is that luckily Stephanie and some of the other volunteers from VOSIS will be at the Dia de los Muertos event. So we were able to provide some supplies and information for that. Unfortunately, I didn't have enough people to send anyone, but luckily Stephanie and her her compadres will all be there, which will be fabulous. And just continuing to try to reach out with other events as we can.
Wonderful, thank you. I plan to be at that event as well, but thank you in advance to VOSAs for all of their work in our community and for partnering with us. Okay, all right. Any other board comments or future agenda items before we adjourn?
No, just a big thank you to Teresa and to Rachel and everybody for getting the supplies ready and coordinating to the best of your abilities. And yeah, it's going to be exciting. I know this has been underway for a while, but we're expecting to see within the time frame of 4 hours about 300 people, and just making sure we get that information to folks as well about anything that might be coming up and who to connect with if they have any kind of questions related to resources for COVID and so forth. But we'll do our best.
Thank you.
Wonderful. Well, thank you all for attending and for your participation and all of your contributions. We will, of course, look forward to our next board meeting, and our new time for our virtual government public engagement committee meeting will be the 4th Wednesday of each month at 5:30. So hope to see all of you next month. Thank you again and stay well.
All right. Thank you all. Appreciate it.
Good night.